is a mosquito-borne viral disease that has rapidly spread to all regions of World Health Organization in recent years. Dengue virus is transmitted by female mosquitoes, mainly of the species of Aedes aegypti and to a lesser extent Aedes albopictus. These mosquitoes are also vectors of chikungunya, yellow fever, and Zika virus. Dengue is widespread throughout the tropics with local variation in risk influenced by climate parameters as well as social and environmental factors. Dengue is found in tropical and subtropical climates worldwide, mostly in urban and semi-urban areas. Transmission of dengue. Transmission through mosquito bite. The virus is transmitted to human through the bites of infected female mosquito, primarily the Aedes aegypti mosquito. Other species within the Aedes genus can also act as vector, but their contribution is secondary to Aedes aegypti. Naman to mosquito transmission. Mosquito can become infected from people who are viremic with dengue. This can be someone who has asymptomatic dengue infection, someone who is yet to have asymptomatic infection. They are pre-asymptomatic. But also, people who show no sign of illness as well, they are asymptomatic. Human to mosquito transmission can occur up to 2 days before someone shows symptoms of illness, up to 2 days after the fever has resolved. Risk of mosquito infection is positively associated with high viremia and high fever in the patient. Conversely, high level of dengue-specific antibodies are associated with a decreased risk of mosquito infection. Most people are viremic for about 4 to 5 days, but viremia can last as long as 12 days. Dengue characteristics, sign and symptoms. While majority of dengue cases are asymptomatic or show mild symptoms, it can manifest as a severe flu-like illness that affects infants, young children, and adults, but seldom causes death. Symptoms usually last for 2 to 7 days after an incubation period of 4 to 10 days after the bite from an infected mosquito. The World Health Organization classified dengue into 2 major categories: dengue with without warning signs and severe dengue. The classification of dengue with or without warning sign is designed to help health practitioners triage patients for hospital admission, ensuring close observation, and to minimize the risk of developing and more severe dengue. Dengue should be suspected when a high fever, 40 degrees Celsius, 104 degrees Fahrenheit, is accompanied by 2 of the following symptoms during the febrile phase 2 to 7 days: severe headaches, pain behind the eyes, muscle and joint pains, nausea, vomiting, swelling glands, and rash. Severe dengue. A patient enters what is called the critical phase normally about 3 to 7 days after illness onset. During the 24 to 48 hours of critical phase, a small portion of patient may manifest suddenly deterioration of symptoms. It is at this time when the fever is dropping below 38 degrees Celsius, 100 degrees Fahrenheit in the patient, the warning sign associated with severe dengue can manifest. Severe dengue is a potentially fatal complication due to plasma leaking, fluid accumulation, respiratory distress, severe bleeding, or organ impairment. Warning: signs that doctors should look for include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, failure, restlessness, liver enlargement, blood in vomit or stool. How to prevent getting dengue. Watch the TikTok video I made how to prevent getting dengue. Hey guys, for today we're gonna talk about how to prevent getting dengue. Number 1, remove stagnant water surrounding your house. So you need to clean your roof gutter, water vases, and your bed container and anything that contains water. Number 2, wear protective clothes like sweaters, pajama, pants, or anything that helps to cover your skin. Number 3, screen window. This is actually a good way in order to avoid mosquito getting inside in your house. Number 4, dispose your waste properly. Number 5, keep your house clean. Number 6, apply off lotion or any insect repellent to avoid insect bites. Last but not the least, contact a pest control company. In this way, they will be able to check your home and your surroundings in order to avoid mosquitoes.